a couple of minutes past 1, so I think we'll start now. For anyone who doesn't know me, I'm Claire Hasty. I'm a lecturer in public health. I'm in the public health research group at SHW. I have an interest in environmental health and its effects on population health. But what I should say before I introduced our speaker is that it was actually Claire Niedowitz who invited Alessandro today. I'm just chairing on her behalf. So thank you so much, Claire, for sending out the invitation. I'll read out Alessandro's bio. So really happy today to welcome Alessandro Massazza. He works as a policy and advocacy advisor at United for Global Mental Health, where he manages a portfolio of projects on the intersection between climate change, the environment, and mental health. He has an academic background working on mental health and psychosocial support in settings affected by adversity. After a period working on mental health in humanitarian settings for the World Health Organization headquarters, Alessandro moved to the Wellcome Trust, where he supported initiatives at the intersection of climate change and mental health. He's passionate about data, science, and evidence. So welcome, Alessandro. Thank you so much for joining us today. If you'd like to bring your slides up, and hopefully they'll share as they did when we practiced 10 minutes ago. Just to see if anybody has any questions, can you please put them in the chat, and then hopefully at the end we'll have time for Alessandro to answer some of them.
Great. Thanks, Claire. Just checking that you can see the slides.
Yes, we can see them. Thank you.
Wonderful. Let me just move the screen here. There we go. Wonderful. So yeah, thank you so much for the introduction, Claire, and thank you very much for the invitation. As I'd mentioned to Claire before joining this call, Glasgow has a special place in my life, as it's where both my grandparents live in, where I would spend most of my summers and Christmases as a child. So I'm really happy to be able to connect to the university, even if not being there in person. So in terms of the outline for this presentation, I'm going to start by providing you with a brief introduction on the impacts that climate change has on health generally, but then really dive into the mental health impacts of climate change. The second part of the lecture will focus, on the other hand, on the co-benefits that can come to mental health from climate action. And I will also finish by providing a couple of pointers for people on what you can do as a health researcher or as a health practitioner in the space of climate change and mental health. Before going into the actual content of the presentation, as a caveat, this is an introductory presentation on climate and mental health. So I will go for a breadth rather than depth in most of the topics, and I will aim this presentation to an audience that might not be familiar with this space. However, if at any point I give things for granted or there is something that you don't understand, please feel free to stop me. Very happy to treat this presentation informally. And I will also be sharing the slides with the organizing team. So I believe you will be able to get in touch with them if you want access to any of the links or the resources I am going to mention during the presentation. But yeah, over to the content of the actual presentation. So we don't have time to go in detail in all of the different ways that climate change is impacting health, but I find this graph from the World Health Organization quite helpful here on the left in summarizing the different ways in which climate hazards, from sea level rise to rising temperature to extreme weather events, can impact health. And you can see really that they can impact health directly, and they can do so on a multitude of different health impacts, from direct injuries because of extreme weather events to the rise in vector-borne diseases. But they can also impact health indirectly by negatively impacting health systems, facilities upon which people rely for their healthcare. And importantly, all of this happens in the context of pre-existing vulnerability factors, which can impact both how much somebody is exposed individually and as a community to the climate hazards, but also to how they experience poor health in the context of climate change. For those of you that are interested in climate and health, the best resource to consult is the Lancet Countdown, which I'm showing here on the right, which is published every year ahead of the UN climate negotiations, or COPs, and provides really the best overview we have on how climate change is impacting health on a variety of indicators, as well as around the health co-benefits that come from climate action. But before zooming into the actual mental health section of this lecture, I wanted to really highlight how studying and researching and quantifying the impacts of climate change, as well as the co-benefits of climate action, is not always easy. And I just wanted to mention two possible reasons why the research space in the climate and health area is complex. The first has to do with attribution. And this is visually explained by this image on the left. And the idea being here that it's not always easy to specifically identify the health consequences of climate change caused by humans. And this is because people get sick for many reasons. Some of these factors have nothing to do with the climate, such as whether you're born rich or poor, whether you inherit specific genes or not, whether you live in a particular part of the world or in another. And there is then a set of reasons that have to do with the climate. But again, among all of the reasons that have to do with the climate, only a subset of these factors are because of climate change directly attributable to humans, so-called anthropogenic climate change. There are many other climatic factors or weather factors that are independent of anthropogenic climate change, such as seasonality of viruses transmission or climate variability that is not because of humans, such as, for example, the El Niño phenomenon that some of you may be familiar with. So basically, if you look at this infographic, zooming in and isolating the impacts that are specifically due to anthropogenic climate change is often difficult and requires methods which allows us to do that. The second reason has to do with complexity and the fact that climate change is complex, so is mental health, and so are the ways in which climate change impacts health. And I've just chosen as an example this really helpful graph on the right, which shows how droughts, which you can sort of see here on the left-hand side of the graph, impact mental health, in particular depression and suicide, at the top right of the graph. And you can see the multiple different pathways, loops, feedback loops through which an exposure impacts a health outcome. And again, this means that when we're studying the impacts of climate change on mental health, we often require methods that allow us to account for that complexity. And that's not always easy. Having said this, I also wanted to turn it back to you and maybe if people want to maybe write in the chat sort of what comes to mind when you think about the impacts of climate change on mental health. What do you think are some of the mental health outcomes that are impacted by climate change? And also maybe some of the mechanisms or exposures. And we can just maybe wait a couple of seconds for people to maybe drop a couple of things in the chat to see what are the things that come to mind again when you think about the intersection of climate change and mental health. Suicide, worry for the future, anxiety, depression, climate anxiety. Anxiety and depression as rational responses, anxiety, climate anxiety. I often speak with young people who feel worry about their future and responsibility for the climate, loss of resources, job stress, predictability. So yes, interesting. So we definitely see quite a lot of sort of outcomes that might potentially have to do with emotions. Again, worry, anxiety, preoccupation. We then seem to see some people mentioning more clinical considerations, such as, for example, suicide and depression, and also people identifying mechanisms, food insecurity, and other ways in which climate change might impacting mental health, which are all, I think, really, really on the spot. And I highlight, I think, the breadth through which climate change is impacting mental health. And I think that's something to really highlight, that often we seem to see, for example, in the media, that certain outcomes definitely receive a lot more attention than others in the climate change and mental health space. But I think that all of these replies make a really good example of the different way of the breadth of outcomes that are being impacted by climate change. So yeah, thanks everyone. So moving now into the different kind of ways and exposure outcome relationships that apply to the climate change and mental health space, I would like to start with air pollution. given that the burning of fossil fuels is ultimately the main driver behind the production of greenhouse gases that are the ultimate cause of climate change. The burning of fossil fuels, whether it's from indoor combustion of biomass for cooking or the exhaust from factories and cars, has a number of negative health consequences. And in particular, it contributes to 8.3 million deaths every year, mainly because of chronic non-communicable diseases such as cardiovascular and respiratory diseases or lung cancer. And according to a recent report, the State of Global Air Report, which is published by the Health Effects Institute in the US in collaboration with UNICEF, air pollution is actually the second leading global risk factor for mortality, coming after only high blood pressure, but before tobacco and poor diet. And besides mortality, we also need to consider the millions of people whose health is being negatively affected by air pollution. And this includes the mental health impacts of air pollution, for which we're seeing increasing evidence, in particular when it comes to the impacts on mood disorders, such as depressive symptoms, as well as neuropsychiatric and neurodevelopmental conditions, relating, for example, to how air pollution impacts brain development. One thing that is quite important to highlight is that we still don't really fully understand in humans what the mechanisms underpinning the relationship between air pollution and poor mental health is. And that is likely to be due to a mix of biological, psychological, and social mechanisms, as often is the case with most things in mental health. The good news when it comes to air pollution is that most of these deaths and illnesses are completely preventable. Unlike the place where you're born or your biological background, air quality can be improved. Clean air is not a luxury, but really a human right that is vital for health and the well-being of everyone, but especially for the most vulnerable in our societies. And an example that I often think about when thinking about the kind of preventability of morbidity and mortality in the context of air pollution as it relates to mental health is this really fantastic study that used countrywide data from China and was published a couple of months ago in Nature Sustainability, and found that reductions in air pollution as a result of China's air pollution action plan prevented between 13 and 79,000 suicide deaths between 2013 and 2017, which means that it accounted for approximately 10% of the decrease observed in China's declining suicide rates, which is quite a staggering number. Again, so as I mentioned before, the main driver of air pollution globally is the combustion of fossil fuels, which at the moment accounts for around 80% of the world energy mix. And this really highlights the need for a fair and just transition to clean energy as a public health intervention, and really for also framing fossil fuels as ultimately a commercial determinant of health, of physical and mental health, as, for example, done by the World Health Organization, just as we would do that with other health-harming industries such as tobacco and alcohol. Another exposure that is relevant to climate change is that of higher temperatures. So, as you may know, 2024 was the warmest year ever recorded, and the first calendar year where the average global temperature exceeded 1.5 degrees Celsius above pre-industrial levels, according to the EU surveying system Copernicus. And this effectively means that the world is experiencing and will experience more frequent and severe heat waves in the years to come. And extreme heat has been shown to have a variety of negative effects on mental health, including, for example, increased mortality among people with pre-existing mental health problems, increased hospital admissions for mental health problems, both psychiatric hospital admissions, but also people living with pre-existing mental health problems being more likely to present, for example, to A&E because of heat-related illnesses. And also we tend to see an increased rates of suicide and suicidal behavior, again, in the context of extreme temperatures. What is less understood, and this is a similar point to the point that I made on air pollution, is what explains these associations. What are the underlying mechanisms underpinning the relationship between heat and mental health? And as with air pollution, this is likely to depend on multiple interacting biological, psychological, and social mechanisms. In the case of biological mechanisms, various hypotheses have been proposed, we know that neurotransmitters such as dopamine and serotonin are thought to be involved in thermoregulation. And we also know that some of these neurotransmitters are thought to be involved in a number of mental health conditions. The idea being here that changes in these neurotransmitters because of heat exposure could potentially have repercussion on mental health. We also know that heat can impact the brain directly, just as it does so with any other organ of the body. And indeed, heat stroke, for example, is often characterized by a number of neuropsychiatric presentations, such as confusion and other symptoms that can often also appear in other mental health conditions. We also know that people living with mental health problems often have comorbid physical health conditions, such as non-communicable diseases, that then put them in turn at higher risk of mortality or worsened health outcomes during extreme heat. And finally, some have also suggested that taking certain psychotropic drugs may increase one's vulnerability to heat. And this is quite an interesting new space, and one that often picks up quite a lot of attention in the media and that generates a lot of interest. And at the moment, it feels that it's quite largely based on either clinical experience or on self-reports from people taking these psychotropic medications, but also on epidemiological evidence showing that people taking certain psychotropics tend to be at higher risk of mortality or hospitalization in the context of extreme temperatures. However, it is often quite difficult in these studies to isolate the effect of taking psychotropics from the many other possible risk factors that often co-occur with taking psychotropic medications. And indeed, the most recent meta-analysis and review of the evidence on this specific question found that there are very few studies that specifically test the impacts of psychotropics, such as antipsychotics or antidepressants, on core body temperatures. And the few studies that exist, for example, on antidepressants didn't seem to find an effect, indicating that the impact of psychotropics is probably more complex than previously thought, and that maybe we should also exercise some caution when claiming that psychotropics make people more vulnerable in the context of extreme heat, to avoid people sometimes being more reticent to take potentially life-saving medications. At the psychological level, we have all probably experienced changes in our mood when exposed to extreme heat, being more irritable, angry, and again, there's quite good evidence around the linkages between extreme temperatures and mood. Additionally, people living with more severe mental health problems may sometimes experience what is known as compromised insight, which means that sometimes they might not always respond appropriately to the external environment. So they may, for example, fail to keep hydrated or to dress appropriately, and that can put them at higher risk in the context of extreme temperatures. Additionally, as people, again, may know, alcohol and substance use tends to increase often in the context of extreme temperatures, as people spend more time outside, socializing. And again, alcohol and substance use often interact in complex bidirectional ways with mental health. And finally, sleep is one of the mechanisms that has been really the most explored at this intersection, with both sleep quality as well as sleep quantity being negatively impacted by high temperatures. And sleep, again, as well, having a bidirectional relationship with mental health problems, so that we know that poor sleep can contribute to poor mental health, but also that experiencing poor mental health can contribute to poor sleep. And I mentioned the Lancet countdown on climate change and health at the beginning of the presentation. And in the latest iteration of the report, they included a new indicator on sleep. And they looked at how sleep had changed with extreme heat. And they found that sleep hours that had been lost due to high temperatures had increased by 5% in recent years when compared to the period between 1986 and 2005 because of the increase in temperatures. And finally, a number of social mechanisms are also likely at play. So people may experience disruptions to their usual coping mechanisms. For example, they may not be able to exercise physically outside because of excessively high temperatures. People that cannot leave their houses, especially elderly people, may experience higher levels of social isolation, which can have cascading impacts on mental health. And additionally, there is a complex relationship between mental health and poverty, meaning that sometimes people living with severe mental health problems may lack access to appropriate adaptation measures such as well-insulated housing or air conditioning, which can protect them from the health impacts of heat. And finally, one of the behavioral and social outcomes that has been the most studies in the context of heat is violence and aggression. And indeed, we tend to see an association between violent behaviors, whether it's homicides or gender-based violence, in the context of extreme temperatures. And again, I wanted to bring you an example from a recent study in JAMA Psychiatry that looked at rates of interpersonal violence in India, Nepal, and Pakistan, and found that for every 1 centigrade Celsius increase in annual mean temperatures, they saw an average associated increase in interpersonal violence of 4.49%. Again, when we try and zoom a bit more into the mechanistic association between heat and violence, it's not yet fully understood exactly why we tend to see this association. To sort of make it simpler, there's usually 2 theories that are brought forward. One is the so-called temperature aggression theory, which really relates to what we discussed before in terms of impact of heat on mood. And the idea here is that heat impacts mood and makes people more irritable and therefore more likely to engage in violent behavior because, for example, simply a state of physical discomfort. And the other main theory is that around routine activity theory, which suggests that heat may increase the number of circumstances in which people tend to engage in violent behavior. So again, people may be outside more and therefore interact more with people. They may be drinking alcohol. And as a result of that, the circumstance of the context that might make violence more likely is increased. Beyond air pollution and temperature, the increase in global average temperature is contributing to more extreme and frequent weather events such as floods, storms, and these can all have significant impacts on mental health. And this can really happen via 2 main pathways. One is directly, so people are exposed to potentially traumatic events such as death or serious injury, which again often represent risk factors for the development of certain mental health problems such as post-traumatic stress disorder, depression, substance use disorders. But also all of these events can impact mental health indirectly, with these events impacting what are known as the social determinants of health. So again, people exposed to flood, storm, you may lose your job, you may lose your house, and all of these factors can impact mental health often just as much as the acute traumatic exposure itself. In the context of mental health, it's also really important to clarify a couple of things in relation to mental health following extreme weather events and emergencies. So the first is that everybody, understandably, will experience a degree of psychological distress. They might experience emotional and behavioral symptoms such as feeling on edge, having sudden unwanted memories of a distressing event, struggling to sleep immediately after an extreme weather event. And it's really important to highlight that these are, in most cases, normal reactions, and they're not mental health problems per se, as we know that the majority of people will recover with their own individual and community resources, and that only a minority of the people that have been exposed to extreme weather events will develop new mental health problems as a result of the event. That is not to say that that minority shouldn't receive the care that it deserves, and that often when we are thinking about very large-scale extreme weather events, a minority can still imply a huge strain on the health system, but it's also to highlight the importance of considering also the resilience of communities and people after disasters. At the same time, we know that people living with pre-existing mental health problems may at times be more vulnerable in the context of extreme weather events. As, for example, they may be more at risk of human rights abuses. So in some cases, people with severe mental illness may be left behind. And also they may experience a worsening or a relapse of their mental health problems. This is a population that requires often particular attention, but often on which we don't have a lot of research, unfortunately. And as shown in the answers in the chat, I don't think an introduction to climate and mental health can be complete without mentioning a number of emerging psychological constructs which are receiving a lot of attention, both in terms of the media as well as academic research, such as, for example, climate anxiety, so nostalgia, ecological grief, And unfortunately, we don't really have time to go in depth into each of these constructs, which would likely deserve a lecture on their own. But I think one message that is helpful to underline is that in most cases, feeling worried or anxious about climate change is normal and not a mental health problem. And often we can think about worry and preoccupation about climate change as an adaptive reaction when it can contribute to people trying to address this discomfort by engaging in climate action. And indeed, we do tend to see often evidence that indicates a positive relationship between higher levels of climate distress and pro-environmental behaviors. And again, this is really not to say that people experiencing elevated levels of climate distress should not be supported in appropriate ways. And also to say that to date, we don't yet fully understand very well the relationship between experiencing climate distress and, for example, mental health problems, and how mental health problems may interact with experiences of difficult climate emotions. One possible model that could be useful in navigating this complex space of mental health problems, climate emotions, is what is known as the dual continuum model, which is a model that is also used by the World Health Organization. And it's a model that suggests that mental health problems and mental disorders are related but conceptually and empirically distinct from mental well-being. And they have different risk factors and outcomes, and that one can really place individuals in different parts of these intersecting axes. So you can see here in this image, you have the no mental disorder, severe mental disorder on the horizontal axis, and then high levels of well-being and low levels of well-being on the vertical axis. And so, for example, in the top right corner, you may have someone that may be living with a mental disorders, but they may be experiencing high levels of well-being, just as somebody living with a physical disability can experience high levels of well-being. For example, because they're coping well with their mental health problems, they're well supported. But at the same time, you may have someone in the bottom left that doesn't live with a mental disorder, but that is experiencing poor levels of psychological well-being. And according to this dual model, the suggestion is that the largest burden of disease from climate change would probably come from mental health problems resulting from extreme weather events. So here in the bottom right, while constructs such as climate distress and climate anxiety will probably largely impact the lower well-being side of things, and less so the kind of mental disorder end of the spectrum. And finally, I think it's also really important to highlight that physical and mental health are really different faces of the same coin, and that they interact in complex bidirectional patterns, so that experiencing more climate-sensitive diseases such as dengue or Zika is likely to have negative impacts on people's mental health. But also, as we know, for example, from the literature on the relationship between mental health and HIV, living with a mental health condition can make people more at risk of developing these conditions because of their underlying vulnerability and a number of risk factors, and also that living with the mental health problems can interact with how people receive treatment. So, for example, in terms of adherence to one's medication regime or in accessing treatment and receiving care from the healthcare profession. So moving now to the second part of the lecture, which is about interventions. Before we go into the relevance of climate action to mental health, I just wanted to do a very simple distinction between how climate action is usually thought about in the climate space. And this common distinction is that between adaptation and mitigation strategies. And a simplified way to think about these two constructs is that mitigation is really concerned with the ultimate causes of climate change, that is fossil fuels and the combustion of fossil fuels, whereas adaptation focuses on the consequences of climate change. So this means that adaptation actions focus on ways to reduce or adapt to the consequences of climate change. So for example, more extreme temperatures, more extreme weather events, whereas mitigation actions focus on trying to reduce or mitigate greenhouse gases as the ultimate cause of climate change. And climate actions can have a number of positive impacts on health, and these are collectively known as the health co-benefits of climate action. And I just wanted to show you this really helpful image by the World Health Organization that outlines the different health co-benefits of various mitigation activities, again, from active modes of transport to more urban green space on both physical and mental health. And in the next two slides, I will present two case studies, both relating to adaptation and mitigation and how they can lead to mental health co-benefits. So one example from the adaptation side of things is the Southern Australia heat warning system, which basically is interesting because whenever a heat wave is identified as happening in the next couple of days, the government, together with the Red Cross, issues targeted outreach to vulnerable populations. And this includes people that are experiencing homelessness, older adults, but also people living with mental health conditions. And what this means in practice is that in the context of extreme temperatures, daily welfare telephone checks are organized, targeting people in these groups. And home welfare checks in person are also scheduled in case of a missed answer. And this has been shown to, one, lead to significant reductions in adverse health outcomes, such as mortality and hospitalizations, but also importantly, to be a cost-effective intervention. And indeed, we are also seeing how similar interventions are being anecdotally picked up in other cities around the world, for example, Dhaka and Athens, in which psychological considerations are being integrated into heat health action plans. On the mitigation side of things, I really love this scheme, which was rolled out by the Irish government to provide energy updates to people that were living in energy poverty and also with chronic respiratory issues. And what the government did is that it provided energy updates to these homes, and an analysis and evaluation by the London School of Hygiene and Tropical Medicine found that obviously energy updates made these houses more energy efficient, but they also led to improvements in their respiratory outcomes. And interestingly for us, they also found that that led to reductions in anxiety and depressive symptoms and improvements in overall psychological well-being. So again, this is an example of an intervention more on the mitigation side of things. However, we really need more work on policy interventions that work, as to date, most of the research on mental health and climate change still focuses on impact. So a review that we conducted in 2021 found that 85% of all of the literature on climate change and mental health focused on impacts. And this is despite the fact that many interventions are being routinely implemented all over the world to promote mental health and protect mental health in the context of climate change, but very few are being robustly evaluated. So a recent systematic review by Lynn Flores found that only 2 randomized control studies exist to date that test the effectiveness of adaptation and mitigation strategies, and the co-benefits that these may bring to mental health. And this really trickles down into the policy space, and it's very much reflected by the lack of attention to mental health and climate policies. So to give you a couple of examples, I will start with the nationally determined contributions, or NDCs. And NDCs are what UNDP calls the climate promises that countries commit to every 5 years to show how they're planning to align with the goals of the Paris Agreement. And for example, this year countries are supposed to submit the 3rd iteration of their NDCs. And the WHO does a really helpful job of summarizing and reviewing how health features in NDCs. And as you can see on this graph on the right, out of all of the health outcomes included in NDCs, mental health here at the top is one of the least included outcomes, with only 3% of existing NDCs references mental health. And when you compare that to vector-borne diseases or heat-related illness, you can really see how there is a huge discrepancy between the coverage of mental health and the coverage of other physical health outcomes. And these are only NDCs. You will probably find very similar patterns when you look at other types of climate policy. So for example, only 5% of national adaptation plans, which outline how countries are adapting to climate change, include actions to address mental health and psychosocial needs. Only a minority of countries integrate mental health and psychosocial programs into disaster preparedness and risk reduction programs. And even more surprisingly, a recent paper published by Catherine Zangler in The Lancet found that 0 out of 160 national adaptation policies included any reference to children's mental health. Things are changing, and here I wanted to flag 3 examples from the last 2 years that represent multilateral agreements on climate and health, which explicitly include references to mental health. So, as some of you may know, 2 years ago at COP28 in Dubai, there was the first ever health day, which was again dedicated to health and allowed many ministries of health to attend, and a COP declaration on climate change and health to be signed and endorsed by more than 150 countries. And that declaration includes an explicit reference to mental health, whereby mental health is included as part of a comprehensive response to climate and health needs. Last year, at the last World Health Assembly, there was a resolution on climate change and health, which was passed by member states, in which mental health is included when recognizing the impacts that extreme weather events are having on livelihoods, physical health, well-being, and mental health. And finally, I wanted to mention, as we haven't really been able to touch on the biodiversity angle, the recent Global Plan of Action on Biodiversity and Health by the Convention on Biodiversity, on Biological Diversity, which again was passed last year at the Biodiversity COP in Colombia, which highlights both the impacts of biodiversity loss and degradation on mental health, but also the positive contributions that nature can make to people's mental health. And these may look like really dry UN documents, but they represent historical examples of multilateral agreements whereby countries all over the world agreed on the importance of considering mental health in these discussions. And to conclude, I think in the climate space and possibly also in the mental health space is often easy to feel discouraged or helpless in the face of such a complex task. But there are also many actions that people can take as health researchers or as health professionals to take action. And I've listed a couple of examples below. A very first concrete one is that the World Health Organization is currently asking for signatories to a call for cleaner action ahead of the WHO Second Conference on Air Pollution and Health. And you can consider signing up for the call, either as an individual or as an organization. And the call is really focused on calling on world leaders to stop pollution and ensure a future with clean air for all. I think it's also important to remember that you're not alone in this space. There's many networks and alliances that you can join that focus on research and advocacy work in the context of climate and health. And I've mentioned a couple here, such as the Global Climate and Health Alliance, the Planetary Health Alliance, the Global Mental Health Action Network. And then you can also consider using your voice as a trusted health professional or as a health researcher to effectively communicate to the public and to relevant stakeholders about the links between climate and health and the co-benefits that can come from climate action. And again, the World Health Organization recently developed a wonderful toolkit for effective communication by health professionals on climate and health. And finally, even if you're not explicitly researching climate and health, most research on health can be made relevant to climate change considerations. So, for example, have you considered how climate change might be impacting the phenomenon that you're investigating, or whether you could consider adding an environmental measure to your study, whether it's a measure of temperature or air pollution? And finally, if you're specifically interested in mental health and climate change research, I wanted to encourage you to join the online hub by the Connecting Climate Minds team, which is a virtual space for researchers interested in this intersection, where you will be able to connect from researchers all over the world and to identify possible partners for future research collaborations. So I hope this was a helpful presentation. I also was told to leave some time for Q&A. So thank you so much for taking the time, and I hope this was helpful. And I guess I'm going to pass it over to anybody that has any questions.
Thank you so much. I really liked your slides about what can I do, because this can feel quite overwhelming at times. And I really related to a lot of the feelings people expressed in the chat. It is a lot to think about. If anyone has any questions, can you put them in the chat? Or if you like, you can put up your hand if you want to speak to Alessandro directly, and we can actually have a discussion. While people are thinking of questions, Lucy Pickering just wanted to highlight an event that's happening, I think, next week. And I'll just monitor for questions while you're speaking, Lucy.
Great, thanks. And thank you for letting me hijack this. So I'm one of the co-conveners of the Global Health and Environment Interdisciplinary Research Theme, and we are running a networking event for Glasgow University staff interested in this area, including mental health, on the 4th of March, which is next Tuesday, and I will put a link to the event Eventbrite in the chat. Thank you very much.
Thank you, Lucy. Okay, so we had a question about the slides back up with the hub, and Alessandro's done that. We've got a question from Nina. So given that the lack of mental health data in countries like Ecuador is linked to limited resources and the low priority given to this area, what strategies or approaches could be implemented to improve data collection and mental health evaluation in context with limited resources?
Yes, this is the 1 million question in the climate and mental health space, and possibly also in the global mental health space more generally, which relates to the issue of a lack of comparable, robust data at the global level in the context of mental health, and often with countries from low middle income settings most impacted by this. And this, for example, is really reflected by the fact that, to give you a concrete example, the Lancet Countdown on Climate and Health, which I mentioned before, has a variety of indicators and many health outcomes, but mental health has been an outcome that they have historically really struggled with in terms of identifying an appropriate measure of how climate change impacts mental health. So I mentioned before that they now have an indicator on sleep, and they also had an indicator for a couple of years looking at sentiment expressed over social media and how that interacts with exposure such as heat and precipitation. But again, these are indicators that might be proxy measures for mental health, but that do not completely map onto often what we refer to as mental health. I think this gives you a bit of a sense of the nature of the issue, and the fact that probably is that the issue you're experiencing might not be unique to Ecuador, but I think it's very much an issue that is shared by many contexts across the world. I think, to answer your question concretely, one of the ways in which mental health could be better integrated into climate and health data has to do with countries' assessments of vulnerability to climate and health. So you may know that, for example, the World Health Organization, but also the World Bank, conduct climate and health vulnerability assessments for countries. And what we see happening is often mental health tends not to be included in these assessments, at least anecdotally. And this means that effectively doesn't allow mental health to then trickle down into climate policies, because it's not measured in the first place. So I think something that people can do, whether they're researchers or civil society actors, is advocate for mental health to be integrated whenever climate and health vulnerability assessments are made, as that will allow for mental health to then kind of be integrated in these policy mechanisms. There's also obviously a lot of work happening around more novel ways of collecting data, for example, using wearables that allow for more granular testing of associations, for example, between environmental measures such as temperature or air pollution, because they allow often a precise understanding of the exposure that a person receives, but also a better understanding of behavioral, for example, outcomes such as activity or sleep, which would allow, again, us to get better data on the understanding of climate and mental health. So I think it's something that has to do both with the way countries are collecting data, but then also as researchers, how can we think creatively about new methods and ways of collecting data, both on climate exposure and on mental health.
Okay, thank you. We have a question from John Olson. So how do you think the switch politically to deprioritize climate solutions will impact mental health, and how can this be mitigated?
Yeah, that's a good question. I think ultimately the obviously the kind of easiest way to protect mental health in the context of climate change would be that of ensuring a fast, just transition to renewable energies in a way that protects human health. So any policies that delay that process or make that process more complex will inevitably have huge impacts on human health, both physical and mental health. And all of the impacts that I've mentioned are likely to be worsened if climate change is not appropriately addressed in line with the Paris Agreement. In terms of how these can be mitigated, again, I think that really touches on the work around the co-benefits, and also about thinking in terms of how health can be used as an argument to accelerate climate action. And that has been a stance that has been increasingly being pushed for example, by the World Health Organization, about trying to frame health as the argument for climate action. We've seen for, again, decades, different ways of trying to frame climate change in terms of its social impacts, in terms of its economic impacts. And these are definitely arguments that are important to make. But adding to that a health lens can also ensure that pressure is put on policymakers, because again, health is something that we all experience and is a way of highlighting the human face of climate change, and how, very materially speaking, is a way of really highlighting how climate change gets under people's skin and impacts again their health. So I think trying to frame health as an argument for climate action could be a useful way of pushing for that mitigation. And again, there's also relatively good evidence showing us that health framing is also potentially a positive way of ensuring that people are supportive of climate action, and that when you frame climate change as a risk to health and climate action as a win-win opportunity for health, people are more likely to be able to engage in climate policies. And I can paste a link in the chat from a recent paper in Nature that was looking exactly at this question around health framing and climate change, if people are interested.
Thank you. We have a question from Francesco Manca. Is there any study showing whether climate anxiety is associated or not with climate change exposure?
Thanks, Francesco. Yes, I think there would be studies looking at the association between climate anxiety and different types of climate change exposures. And we do tend to see that people that have been exposed to extreme weather events or other types of climate exposures tend to experience, understandably, higher levels of worry and preoccupation around climate change. And an issue is not necessarily an issue, and I don't think it's unique to climate anxiety, and I think it really taps into a generalized problem in the mental health space, is that often it's quite difficult to agree on what climate anxiety is in the academic literature. And actually, there was a paper published, I think, a couple of days ago that tried to do some factor analysis work around all of the different measures on climate anxiety that have been produced up to now, and found very little reliability between the kind of different climate anxiety measures, highlighting that potentially, you know, different studies are measuring different things despite all calling it climate anxiety. And I think, having worked in this field from quite some time, I've also seen how climate anxiety as a term has really shifted in the way it's defined. So when I started working in this space, climate anxiety was very much about worry about the prospect of future climate change. Whereas I feel that nowadays, and for example, I was at COP last November, and many young people were discussing climate distress and climate anxiety, and climate anxiety seems to have become more of this all-encompassing term that captures all of the different ways in which mental health is being impacted by climate change. So not only the prospect of future climate change, but also, again, as you mentioned, Francesco, people that might be worried because they have already been exposed to a climate event and they worry about it happening again. And we know that one of the aspects of climate change and mental health that hasn't yet really been fleshed out that much is the understanding of how compounding climate events are going to impact mental health in the long term. Because again, we're seeing events that might have once been considered once in a lifetime events happening regularly, happening more frequently, more intensely, and without allowing people to naturally recover from these events. So I think, yeah, to your question, yes, and please feel free to reach out to me, and I'm happy to kind of share a couple of examples with you. But again, with a caveat that often climate anxiety means different things depending on how somebody is measuring it, and historically that has also changed quite a lot.
Okay, so we've got maybe 2 or 3 more questions already. So one from David, building on Jonathan's question, which was a couple back, how should we approach bringing adaptation versus mitigation into research framing?
Yeah, that's a great question. And if the question, I guess, is about sort of the choice between adaptation and mitigation, I guess that's a tricky question, and it probably largely depends on the context in which somebody's planning on doing research. And in most cases, I would say that the distinction between adaptation and mitigation is often not always super clear cut. So again, if we think about an example about sustainable health facilities, so for example, putting solar panels over a health clinic, again, that per se can be framed as a mitigation strategy, because again, you're ensuring that the health facility runs on clean energy, it's more sustainable. But that is also an adaptation intervention, because it means that when electricity cuts off because of an extreme weather event, the health facility can still function. So again, that is an example of an intervention that would be usually framed as a mitigation intervention, but that also has important implications for adaptation. So again, the distinction is often not necessarily super clear cut, and it's likely to depend on the context in which you're planning to do research. But again, to the question about how to integrate it, I think in the context of mental health, at the moment, we're really very much at the stage of the baseline being so low that just advocating for mental health measures to be integrated whenever these type of interventions are being implemented would already be an incredible step forward. So again, the example of the warmth and well-being scheme in Ireland is a really good example of an evaluation of a mitigation intervention, which basically simply added the PHQ and the GAD, which are measures of around kind of 7-8 items of depression and anxiety, to an evaluation, and allowed them again to have precise estimates of how these interventions had co-benefits for mental health. So often it's really about, given the fact that the baseline on the mental health space is so low, adding measures and really thinking about which interventions could be evaluated. For those of you that are interested specifically in the mitigation side of things, the Pathfinder initiative is an initiative run by the London School of Hygiene and Tropical Medicine that is looking specifically at the linkages between mitigation activity and health. So I'm pasting the link in the chat, and they published a really helpful kind of report outlining the sort of different also considerations in the space.
It's really helpful to have simple suggestions of ways we could bring this into our research. Thank you. So now Basu has a question that's more along the kind of teaching, education side of our work. So she says, we need to prioritise this at the earliest stages of medical training. How do we equip our future prescribers and decision makers to be able to help steer relevant and resilient care for patients and peers living with or at risk of mental health disorders in the context of climate change? So she says, can you offer a bit of a wish list?
Yes, great question, and actually a question that has sparked a lot of discussion in recent years. And one group of organizations that have been really active in advocating for climate and health considerations to be better integrated in the medical curriculum are the International Federation of Medical Student Association, IFMSA. So I would, if this is an area that you're interested in, I would really suggest kind of having a look at the work that they have done, and I can try and find out. They also conduct regular reviews of how climate and health considerations feature in medical curriculums. And one of the first reviews they did showed very, very low estimates. But again, we have seen climate and health considerations being increasingly taken up in the medical curriculum, and also how environmental considerations can be sort of very actionable things to be integrated within medical practice. So again, in the context of air pollution, how asking, for example, at a screening stage, whether the postcode of where a person lives, and being able to associate that, for example, with the level of air pollution that they're being exposed to, is something that is, for example, being often called within discussions within the World Health Organization. So about how you integrate data and information on the exposures that people are experiencing because of environmental or climate-related issues and their health. But in terms of a wish list, I think that referring to the guidelines from the International Federation of Medical Student Association would probably be the best place to start. And obviously, as a mental health researcher and advocate, ensuring that mental health is covered within these discussions is really key. And I think also that is covered in a way that captures the complexity of the different outcomes that are being impacted by climate change. I think, if there's one thing to bring away from this presentation, is really the breadth of ways in which climate change impacts mental health. It's not just about one specific outcome being impacted, but it's really about the whole range of mental health, from emotions to severe mental illness, that are impacted by the changing climate.
Thank you. Okay, so we're nearly at 2 o'clock. I think we'll just have one final question from Sarah Curtis. So she's put a link to a publication in the chat. And our question is, would you like to say something, Sarah? You've appeared. No, we need to think. Go ahead.
Well, thank you. Great talk. Thank you very much indeed. I absolutely agree with the last point you made about complexity. It's something actually that we've been publishing about for a while. I've stuck a point in the chat just to say that I think it's important that you've been talking about local strategies that are adapted to specific local conditions, as well as national and global strategies. And from our previous experience, dating right back to 2017 and before, carrying out research about these issues, although not specifically about mental health, it is quite difficult on the ground, especially at local level, for the people involved in providing care to be able to find space to consider these issues when they've got so many other things to consider as well. I think that needs to be taken into account. And also, as I say, we did some work around these kind of themes back in before 2017. So can we learn from past experience more effectively?
Absolutely. I really agree. And I think, this is actually also very much the case in the mental health space. So for example, there's a whole history of literature on disasters and mental health. And often the disaster risk preparedness or the disaster response space is, for some reason, disconnected from the climate change space. And I really agree with you. I think trying to ensure that the data and the evidence that is already out there is used in the most sensible way. It's so important, especially given the time pressures of the issue that we're facing.
Thank you. Okay, so there's quite a few links in the chat that have been put in by different people, if you want to have a look. Alessandro, thank you so much. I really liked the interactivity and the level of engagement from people. This has been a brilliant Morris block. So you're happy to share your slides afterwards, you said? Brilliant.
Absolutely. And I've also pasted my email in the chat if anybody needs to get in touch. But yes, shall I send my slides to you, Claire?
Yeah, that would be great. Thanks. So I can circulate them. But thank you so much for answering everyone's questions and for a really engaging presentation.
Thank you so much for inviting me. And hopefully I'm going to be at Glasgow at some point to visit my grandmother, and I can drop you.
Come and see us. Come to the Clarice Pearce building. We'll show you around.
Absolutely. Great. Thanks so much, everyone.
Thanks.
Claire.
Thanks, Alessandro.
Bye. Bye-bye.